Folks, we're putting a stop to insurance companies gaming the networks and making them reveal any hidden facility fees. They got to reveal them. And for the first time in history, the Consumer Financial Protection Bureau and the Department of Health and Human Services and the Department of Treasury are teaming up to investigate whether health care providers promoting medical credit cards are violating federal law. Third, we're lowering prescription drug prices for seniors and people with disabilities. With your help, I signed into law the Inflation Reduction Act. Among the many important things it does, it finally gives Medicare the power to negotiate lower prescription drug prices. Like the Department of Veterans Affairs does now. We've been trying to get this done for decades. I don't know how many times I made this speech on the floor of the United States Senate. Along with many others, but now. And this time we finally beat Big Pharma. Seniors on Medicare who are paying as much as $400 a month for insulin are now paying $35 a month. And I might add, the guy who invented the insulin, he didn't even patent it. He thought everybody should have access to it. It cost $10 to make. To packages made as high as $13. They're still making 3 times what it cost them. It's not like they're being cheated. You know, we also closed the total out-of-pocket drug costs for seniors on Medicare at $2,000 a year, even for expensive drug costs like cancer drugs are $10,000, $12,000, $14,000 a year. Today, the Department of Health and Human Services released a report showing that when these provisions go into effect, they don't go into effect until 2025, 1 in 3 Medicare beneficiaries, that's nearly 19 million people, will save an average of $400 a year. Seniors with the highest drug costs will save an average of $2,500 a year. This is going to reduce out-of-pocket spending by Americans by nearly $7.5 billion annually. And guess what? It matters. When we're negotiating the issue on whether the government's going to stay open, I spoke to some of my MAGA Republican friends. It not only saves the consumer, it saves every taxpayer. You're not paying that extra $7 billion because Medicare doesn't have to take the out-of-pocket and pay it.